Takotsubo syndrome, also known as stress cardiomyopathy or broken heart syndrome, is a type of non-ischemic cardiomyopathy, which means that the heart muscle is weakened without a blockage in the coronary arteries. The condition is named after the Japanese word for octopus pot, because the shape of the left ventricle, the main pumping chamber of the heart, resembles a takotsubo when it is affected by TTS. TTS can occur when a person experiences a sudden and severe emotional or physical stress, such as the death of a loved one, a divorce, a natural disaster, a serious illness, or a surgery. These stressful events can cause a surge of hormones, such as adrenaline and norepinephrine, that can have a toxic effect on the heart muscle and impair its function. The symptoms of TTS can mimic those of a heart attack, such as chest pain, shortness of breath, irregular heartbeat, and low blood pressure. How is Takotsubo syndrome diagnosed and treated? TTS can be diagnosed by performing an electrocardiogram (ECG), a blood test, and an echocardiogram, an ultrasound of the heart. These tests can help rule out a heart attack and confirm the presence of TTS. The ECG may show changes similar to those seen in some heart attacks, such as ST segment elevation. The blood test may show elevated levels of cardiac enzymes, such as troponin, which indicate damage to the heart muscle. The echocardiogram may show a ballooning or abnormal contraction of the left ventricle. TTS is usually treated with medications, such as beta blockers, angiotensin-converting enzyme ACE inhibitors, diuretics, and aspirin, that can help reduce the stress on the heart and prevent complications. Most people recover from TTS within 2 months and have no long-term damage to the heart. However, some people may develop serious complications, such as heart failure, pulmonary edema, stroke, cardiogenic shock, or cardiac arrest, especially if they have underlying heart disease or other risk factors. Therefore, it is important to seek medical attention as soon as possible if you experience any symptoms of TTS. How can Takotsubo syndrome be prevented? There is no definitive way to prevent TTS, but some lifestyle changes may help reduce the risk of developing the condition or having a recurrence. These include avoiding or managing stressor that can trigger TTS, such as emotional trauma, physical illness, or surgery. Seeking professional help or support from family and friends if you are coping with grief, depression, anxiety, or other mental health issues. Practicing relaxation techniques, such as meditation, yoga, breathing exercises, or massage, that can help calm the nervous system and lower the levels of stress hormones. Eating a healthy diet, rich in fruits, vegetables, whole grains, lean proteins, and healthy fats, that can provide the nutrients and antioxidants that can protect the heart and blood vessels. Exercising regularly, at least 30 minutes a day, 5 days a week, that can improve the cardiovascular function and fitness, and release endorphins that can boost the mood and well-being. Quitting smoking, limiting alcohol intake, and avoiding recreational drugs, that can damage the heart and increase the risk of TTS and other heart problems. Following your doctor's advice and taking your medications as prescribed, that can help control your blood pressure, cholesterol, blood sugar, and other risk factors for heart disease. In conclusion, Takotsubo syndrome is a rare but serious condition that can affect anyone, especially postmenopausal women, who are exposed to extreme stress. It can cause symptoms similar to a heart attack and can lead to life-threatening complications. Therefore, it is important to recognize the signs and symptoms of TTS and seek medical help as soon as possible. Moreover, it is advisable to adopt a healthy lifestyle and cope with stress in a positive way, to prevent or reduce the risk of TTS and other heart problems.